Hi there, my name's Dr. Sonal, and these are my opinions only, not of the institution I work for, not related to the medical community of which I'm a part of, but just my opinions. Thank you. Hello there. Today we're going to talk about COVID disease and how you get affected by coronavirus. The way that people will be affected is either by inhaling respiratory droplets out where there is someone that's spreading respiratory droplets, or if you are touching an object where someone else has touched and spread those respiratory droplets, you would need to either touch your eyes or your nose or your mouth to actually introduce those droplets and introduce the virus into your system. Then what are you looking for? So usually about 5 days later, but up to about 14 days later of any questionable exposure that you think you might have had. So basically every time that you leave your home, the 14-day clock starts over. And so for the next 14 days, you're always watching to see if there's any symptoms. And so in that time, symptoms that you might develop most commonly are fever, sometimes fatigue, dry cough. You can lose your appetite or have anorexia. And you can have muscle aches and pains, shortness of breath, or occasionally sputum production. I've had patients present with either nausea, vomiting, diarrhea. About 10% of people do have GI symptoms. And we've also had patients show up with headache, elevated blood pressure, sore throat, runny nose. So these are just some of the symptoms that you might present with if you have been exposed to coronavirus and you're developing COVID disease sometime in the next 14 days after that potential exposure. But the most important thing is if you're not sure, just call your physician, call your MD, and ask them. Because right now there's a lot of pollen and other things out in the air that may be giving you runny nose, that might be giving you a headache, that might be giving you some of these symptoms. And if you're not sure, you just need to call your MD and ask them. Because the big thing is that allergies are never going to give you a fever, and there are some things that are very classic, like a lack of sense of smell, lack of sense of taste, that can be specific for this disease. And so you just want to make sure you run it by your physician, and if nothing else, just call your MD when you're in doubt, because this person knows. Okay, so some of the things that we need to look at besides that include testing and what to do from there, and I'll go over that in a separate video. Thank you.